patient came with flank pain and that goes to back and to the testis also. What do you mean by this? In this, because the pain is going into the testis, that's why you have to examine the testis. There should not be any induration or tenderness in the testis. Flank pain goes to back and goes to the testis with normal testis. That means upper ureteric stone. Another presentation is patient coming with the strong desire to pass urine with small amount of urine is coming out with burning. What is this? This is because of the stone in the lower ureter and that is irritating the bladder. Irritation of the bladder will cause strong desire to pass urine. Urine will come in a small amount because there is only small amount of urine inside the bladder. Next is hematuria. A specific thing is it will be without clot. Another important thing, vomiting and decreased urine output. These two things are important because it can show the deranged renal function test and the patient may require hospitalization in these two conditions. What basic investigations you will do? Number one is ultrasound abdomen with residual urine. In ultrasound, you will notice hydronephrosis, whether it is mild, moderate and severe. In the moderate and severe hydronephrosis, you will be very particular about it. You will be serious about it. You will tell about these things to the patient. Number two is size of the stone, whether it is less than 10 mm or more than 10 mm. More than 10 mm stone is difficult to come out with the conservative treatment. In the blood investigation, you will do blood urea, serum creatinine. If these two things are raised, in that condition, you cannot do contrast study. You cannot give NSAIDs as a painkiller. Next line of investigation are required basically if patient is not getting the relief or the stone is more than 10 mm or hydronephrosis is moderate or severe. In that condition, you will do contrast study if the renal function test is normal. What contrast study? Intravenous urogram or contrast enhanced CT scan abdomen. In the conservative treatment, for pain, you give dicyclomine or NSAIDs. But if renal function test is raised, then you cannot give the NSAIDs because NSAIDs decreases the prostaglandin level in the kidney. That will further damage the kidney. So what you will require, that is paracetamol and tramadol, because these two doesn't affect the prostaglandin level in the kidney. For strangulary, what medicine you will give? Alpha blocker, that is tamsulosin.